Hello, welcome to CarePoint Clinic's education series. Today's topic is an introduction to diabetes. My name is Lori King. I'm a registered nurse and I'm happy to be here today. Our learning objectives are that after participating in this series, you should be able to explain what is diabetes, how did I get diabetes? What happens in my body with pre-diabetes and diabetes? What's the difference between type 1 and type 2? What is an A1C lab test? How can I know if I have pre-diabetes or diabetes? And how can I reduce my A1C? There are 3 ways. What is diabetes? Diabetes is a chronic or long-lasting health condition that affects how your body turns food into energy. Diabetes is the 7th leading cause of death in the United States and the #1 cause of kidney failure, lower limb amputations, and adult blindness. That's why it's very important for us to learn about managing diabetes. The effects of diabetes may be lessened with lifestyle change. How did I get diabetes? It's very important to realize that diabetes is not your fault. Risk factors include a family history of diabetes, environmental factors and geography, race or ethnicity. Studies show that Black, Hispanic, American Indian, and Asian American people seem to be at highest risk. Being overweight or obese increases the likelihood of developing gestational, which means pregnancy, diabetes, prediabetes, or type 2 diabetes. For every person, when we eat food and our stomach digests that food, some of it is turned into glucose or sugar. We can use those 2 words interchangeably. That glucose or sugar is absorbed into the bloodstream through your intestines and is carried to every cell in your body. Glucose cannot enter the cells without a key to unlock the door. So, what might be a sign that glucose cannot get into your cells? What do we need to unlock the door? And what is the key? The pancreas makes a hormone called insulin, and insulin is the key that unlocks the door to the cell. We all need insulin. Sometimes we think of insulin only as a medication, but it's actually a natural hormone that our bodies produce if they are functioning at their healthiest. Sometimes bodies don't produce enough insulin, and that causes those cell doors to remain locked. When we have insulin, the door is unlocked and glucose can leave the bloodstream and enter the cells of the body, giving us energy to do the things we want to do. When we have diabetes, there's not enough insulin or keys in our bloodstream. And that glucose in the bloodstream builds up because it cannot leave the bloodstream and enter the cells of the body. Diabetes is a chronic health condition that affects how your body turns food into energy. Think of a car that does not have enough gas. Similar to that, what happens if your cells do not have enough glucose? You might feel very thirsty. You might need to pass urine more than usual. You might be very hungry or sleepy. You might have blurry vision, low energy, and you might have infections or injuries that heal more slowly than usual. What is the difference between type 1 and type 2 diabetes? Type 1 is thought to be caused by an autoimmune reaction, which is when the body attacks itself by mistake. In this case, the pancreas does not make insulin, so you must take insulin to move that glucose from the blood into the cells. In type 2 diabetes, your body does not make enough insulin to keep up with the glucose levels, or it doesn't use insulin very effectively, and that's called resistance, and therefore cannot keep your blood sugar at normal levels. Most people have type 2. To test your glucose levels, you might need to do a finger stick blood test. Here's a photo of what that looks like. It's a tiny prick on your finger that results in a drop of blood. That is pressed against a paper strip that is inserted in a machine called a glucometer. It measures the amount of glucose in your blood at that moment. A normal result is anywhere between 70 and 100. The A1C is a different kind of test. This is a lab test that is actually looking at your red blood cells. Our red blood cells live for about 3 months. And so we need to wait to retest our A1C after 3 months have passed so that we can look at new red blood cells. When looking at the A1C blood test, the folks in the lab are looking at the marks on your red blood cells left by glucose molecules. The number of the A1C relates to the percentage of the surface of your red blood cells that has glucose marks. So all red blood cells have some glucose marks stuck to them, but a high A1C means that unhealthy amounts of glucose are stuck to the cells. That means there's a lot of glucose in your bloodstream that's bumping up against your red blood cells. You'll likely have this test repeated every 3 to 6 months, depending on your results, after your body has produced new red blood cells, and we can look at the marks on those. So how do I know if I have pre-diabetes or diabetes? You'll want to look at the results of your A1C lab test. If your A1C is 5.6 or less, you do not have pre-diabetes or diabetes. If your A1C is between 5.7 and 6.4, you have what's called pre-diabetes, which means you are at risk for developing diabetes later on. If you have an A1C of 6.5 or higher, you have diabetes. You can see on this chart that A1C can go pretty high. This chart indicates a 14 for an A1C, and it shows us that the average blood sugar or glucose for a person with an A1C of 14 is around 380. You might recall from our previous slide that a healthy blood glucose level is between 70 and 100. If you have diabetes, the goal for most adults with diabetes is for their A1C to be less than 7. If you consistently have high blood sugar or glucose, it can lead to damage of blood vessels. That in turn leads to damage of the tissues and nerves that are fed by those blood vessels, because those doors are locked and that glucose is not getting to those cells to nourish them. This problem can lead to serious health problems such as heart disease, vision loss, kidney disease, and stroke. What causes high blood glucose? Eating too much food that raises glucose, If your pancreas cannot produce enough insulin to meet the needs of your body, if your cells are resistant to the insulin key. And sometimes if we're fasting or not eating for more than 6 hours, our liver can release glucose that it has stored in case of emergency. That's why it's important to eat small, frequent meals throughout the day and not skip meals. Well, here's the good news. There are ways to reduce your A1C. 3 ways to be exact. There's no magic wand, but through modification of your diet or nutrition, exercising, and taking medication, your A1C is likely to go down. So let's talk a little bit about nutrition. There are 3 macronutrients or major nutrients in all the foods that we eat. Carbohydrates provide us with quick energy. Proteins provide us with long-lasting energy and are useful for healing and repair of our cells. Fats also provide us with long-lasting energy, and they help us in absorbing vitamins that are needed for basic body function. So all 3 of these macronutrients are important. Carbohydrates are what we're most concerned about when we're talking about blood sugar or blood glucose. So eating too many refined carbohydrates can increase our blood sugar. This photo shows us foods that easily increase blood sugar because they are high in carbohydrate content. So you'll notice there are fruits in this picture. Those are high in natural sugars. Foods such as breads and potatoes, macaroni and cheese, pretzels, those are high in refined carbohydrates that our body very quickly can turn into glucose. You'll also notice that dairy is in that top photo. Dairy is high in natural sugars as well. Now the bottom photo shows us foods that do not increase our blood sugar very much. So some of these foods in the lower picture do have carbohydrates in them, but they are difficult for our body to process and therefore don't give us blood sugar spikes. Many of these foods in the lower photo are high in protein and fat in comparison to the foods in the top photo. These foods include things such as avocados, most vegetables you might find in a salad, protein sources such as fish and eggs, chicken and lean beef, and peanut butter is also a good source, or any nut butter. Now please note that we do not want you to stop eating carbohydrates. Carbohydrates are good for you, they're nutritious, but we want you to decrease the amount of refined carbohydrates you might be eating, such as mac and cheese and chips and bread and even juice. If you're feeling like some fruit, eat a whole fruit, not a fruit juice. Consider making these lifestyle changes. Eat at least 3 meals a day. Avoid skipping meals. Keep your meal timing consistent throughout the day. Avoid concentrated sweets like candy, cookies, any sort of beverages with added sugar like soda, Gatorade, or Kool-Aid, and fruit juice, as I mentioned before. Aim for balanced meals using a plate method, and I have a slide coming up on that. Consider keeping a food journal along with monitoring your blood sugar if you have a monitor to learn how foods affect you. So you could write down what you eat in a day and check your blood sugar maybe 3 times that day and compare what was my blood sugar after I had eggs for breakfast. What was my blood sugar after I had a milkshake in the afternoon? I think you'll see a big difference. Here's the plate method. You can learn more about this on the website myplate.gov. That website has a lot of information, including recipes and tips and guidelines for following the plate method. Using the plate method, about half your plate will be filled with vegetables and some fruits. A quarter of your plate will be a source of whole grains like a potato or rice. And a quarter of your plate will be protein such as fish or lean chicken or beef. Generally speaking, when you're trying to reduce your carbohydrate intake, it's okay to just drop dairy or only eat dairy such as Greek yogurt, because dairy does have a lot of natural sugars. Let's move on to the next way to decrease your A1C, and that is increasing moving your body. Start where you're at. If you're not doing anything right now, do a little more. Maybe walk to your mailbox to get your mail. Maybe take a walk around your house during every commercial if you're watching TV. If you're already walking, try walking farther. Or maybe doing some stretching exercises as well. Think about joining a walking group or a local community center or a senior activity center. They have a lot of exercise programs in these centers. Your goal is to eventually achieve 150 minutes or more per week of moving your body enough that you're raising your heart rate. Studies have found that folks who exercise 150 minutes or more per week are successful in reducing their glucose levels or A1C. If you are prescribed medication for your pre-diabetes or diabetes, please take it as prescribed. Medication can increase insulin output. It can decrease cell resistance. It can decrease absorption of glucose during digestion. Always ask your provider before making any medication changes. Try to keep a daily log of your glucose readings and report those readings to your provider. That information can help your primary care provider make changes to your medications. I've included a video that you might find very helpful in understanding what's happening in your body with diabetes. And here are some websites that have very useful information that you can use to learn more about pre-diabetes and diabetes and how to manage those chronic conditions. Thank you for your time today, and I hope that you found this installment in our educational series to be useful. Have a great day.